Hello, Dr. Kober here. Today I get the privilege of touring the Gibbeum Hospital, which is where the Kang hernia repair is done. It's the only place where the Kang hernia repair is done. This is one of the coordinators. If they speak English, you can say hello.
Hello, I'm from Gibbeum Hospital International Patient Center. My name is Sonia.
Many American patients ask me about the Kang repair and what it's like. So today we get to see. So come on in. And this is the lobby. So coordinators help patients check in over here. Then the examination is done by Dr. Kang right over here, and we'll walk over. This is the exam area. So patients come here and wait, and Dr. Kang will examine them. And then one of the coordinators will explain the process for the second day, which is the surgery day. And on the second day, you'll again meet one of the coordinators here in the lobby, and they'll take you up to the preoperative area, and that's for the surgery day. So after the examination, he usually will order an ultrasound. So patients just come up to the second floor. It's very convenient here. So we're gonna go up to the second floor. I'll show you that space. So up here on the second floor, the coordinator will take patients to the ultrasound area, get you checked in, and then you take a seat and your name will come up on this screen when it's time to get your ultrasound. And at the time of the ultrasound, they'll determine whether you have a direct hernia or indirect. So after the ultrasound and confirming with Dr. Kang that you have a hernia, the coordinator will help guide you up to the third floor. Blood draw is done, urine test is done, EKG is done, and over here, chest x-ray is done. So after surgery, included in the hospital stay, patients can stay overnight. So you have a hospital bed and you can get nurses to give medicines and care. So that's an option, although some patients choose to go home after surgery. So this is one of the 2 floors here where patients can stay after surgery. Patients check in here, there's full nursing, and there's patients post-op from the hospital, the ER, and outpatient surgeries. Here we are on the 4th floor where the operating room is. We can't go inside because obviously it's sterile garb and all, but I got to tour the operating room, and it's here on the 4th floor, all very convenient. The recovery room's inside here.